Hi, welcome to the Pediatric Telehealth Coffee Hour. Okay, yeah, it's recording. Okay. Sorry about that, guys. It's been a while since I've interviewed anyone. And I'm here again with Elisa Rocks, registered dietitian and nutritionist. You may remember her from her first interview, and she's back. on the
Heck.
on the first interview, she mentioned low tone and carnitine, and I really wanted to know more about it. So she's here to talk about low tone, carnitine, and lots of times with my low tone patient kids, I never thought about what they were eating or what was going on, nutrition wise. So I think this is a great topic. So thanks for coming back and talking with us today.
Yeah, thank you for having me. I'm excited. This is a new topic. I've never really gotten in depth with anyone on this topic, and because I was brushing up on my research on it, the latest research, and it was really interesting for me. So I'm excited.
And so can you tell me, what is carnitine and how is it made and what does our body use it for?
Yeah, so carnitine, it's an amino acid, really, which is amino acids are used to make protein. So it's actually a combination of two amino acids. Um, and it's our bodies can make it. We make about 25% of our needs, and it's made in like the muscles, the liver, I think the kidneys also. And then we get 75% of it from our food, and we get it from other animals because they make it as well. And we can get it from dairy products too. So what it does basically is it acts as a little transporter. It helps bring fat into the mitochondria of the cell where it can be broken down into and used for energy. So if you have someone who has a carnitine deficiency, they will, or rather, problem with their or lack of carnitine, they won't be able to bring fat into the cell. So they're going to be hungry more often. Their body just won't be able to have they don't have that fat as a lasting form of energy for them. So they're going to rely on carbohydrates and on protein.
Okay. And so what causes a person not to produce enough? Would that just be what they're eating, or can their body also not produce enough?
Yes, the body can also not produce enough. That's possible. There's two types. I wrote it down here because it gets like kind of intricate, and I I want to keep it simple. There's two types of deficiency. So the first time, or the first type of deficiency is primary carnitine deficiency, and that's a rare genetic condition where the carnitine just can't get into the cells from the blood. So it is, it's not a supply issue. It's more like a transport issue. And then the second type of deficiency would be secondary, primary, secondary. And that's when there is not enough in the blood. So that's where there's a supply issue. And that could be from the body's not making it well enough. It could be that the kidneys are peeing it out, that we're peeing it out. It could be that we're not getting enough from the food. You might see this in someone who's like a vegan,
Mm-hmm.
or someone who is malnourished. They would, of course, their intake would be reduced, so they might not get enough from food. Other people who may have deficiency, those with liver and kidney disease, of course, because it can be made in the liver and the kidneys. So if you have problems with those organs, you wouldn't make it effectively.
Mm-hmm.
And then those with digestive disorders, because if you can't absorb it from your food, then you may have a deficiency.
Mm-hmm.
And then also, interestingly, so this is where it really applies to my people, those with mitochondrial issues. Mitochondrial dysfunction is something that is, I hear about it a lot these days, but it's fairly new, I think. So I'll say that oftentimes children with autism have mitochondrial dysfunction, and they will also have low tone.
Mm-hmm.
So it could be that the low tone is because of the mitochondrial dysfunction. So basically, if the mitochondria of the cell, that's like the powerhouse of the cell. We're going back to like high school biology here. That's like where all the energy of the cells is produced, the energy that fuels our whole body. So if there's a problem with the mitochondria, they're not working like they should, and they're not able to produce that energy, then you'll get that low tone.
Okay.
So I'll say that the hypotonia can be due to a mitochondrial issue, but mitochondrial issues can also be caused by lots of other things. So
Okay.
it could be, but it might not be, I'll say.
So I know, like in the therapy world, sometimes I'll explain to parents that tone does not the same thing as strength, because their child could be strong when they're contracting their muscles, but
Mm-hmm.
it's when they're at rest. So I'll describe it kind of as a stretched out rubber band, like it doesn't have like the same tension. Is that how you
Yeah,
would kind of describe it as
I
well?
I would like the word that keeps coming to my mind is like floppy.
Mm-hmm.
Like they have floppy muscle tone, and I wrote down a number of other symptoms here that um, you'll see with someone that has deficiency. So you'll see that kind of floppiness, like you said, like a stretched out kind of a loose rubber band.
Mm-hmm.
Someone with carnitine deficiency will also be very tired, of course, because they're that means of producing energy is impacted negatively.
Right.
They might be kind of slow moving or have delayed motor skills.
Okay.
Um, they may have, you might see low blood sugar frequently, because if you can't use fat for energy, then you're using up sugar frequently. You're going to need to eat very frequently.
Okay.
And if you don't, you're going to get low blood sugar.
So would
And
you,
then you may also, oh, sorry, go
sorry.
ahead.
I was just gonna say, if you so could a person or a child be good, like they're everything's in balance, but then something changes metabolically, and then now they present as a low tone child, or they start regressing? Could that is that something that happens too?
Like you're saying, all of a sudden, they could like a regression. Yeah, I mean, we do see that, right? We do see these regressions,
And even with
and it,
autism, right? Sometimes, sorry.
yes, definitely. So could all of a sudden a carnitine deficiency be it? Sure. I mean, it could be that their supply was okay, and then something happened, and over the course of a short period of time, now they're deficient. That could definitely be a cause. With kids with autism, it's the feeding issues, and poor diet is probably right up there with a mitochondrial dysfunction in terms of what would be
Right.
the most common reason for this.
And if
We'll
someone,
also, oh,
sorry, go
sorry.
ahead.
I'll also
So-
add, I just wanted to add that like something that we might also see with the carnitine deficiency is um, in relation to feeding skills, and you may see this with physical therapy, like trouble sucking or swallowing,
Mhm.
um, an inability to sit up straight for any length of time, like you'll see slouching, or they'll need support because
Mhm.
the core muscles they just get fatigued very quickly. So you'll see poor posture. You might see trouble chewing, which that's common. Um, they may have trouble holding their head up, flapping arms and legs, that sort of thing. You may also see weight gain, because if you can't
Oh,
use fat for energy, you're going to store fat's going to have to be stored. There's nowhere else for it to
right.
go.
And what
So,
about if someone has too much? Can they show up as high tone, like having if they have too much
oh,
carnitine?
yeah, this was something that I have heard of hypertonia. So we see it like in people with cerebral palsy. They'll have rigidity in their muscles. But I haven't read anything, and I was digging into this. I haven't read anything that it could be due to too much carnitine,
Mhm.
um, because it's pretty well tolerated even at higher amounts. It's fairly
Right.
safe supplement.
You probably just void
And
out what you're not using.
exactly, excess is just pretty
Yeah.
much gotten rid of.
Good. And then let's see. So I guess from what we're talking about, if we do have a patient with low tone, getting this addressed could help them functionally, because then they'll have more, they'll be using their fat appropriately. But of course, there's probably, because I mean, I've had kids that are like really floppy, like to severely floppy, but I think that would be a good thing to address, to see what changes that we can make functionally. I don't think like those severe cases, they may never get like how we are, but you still may see some functional gains to at least, start using their energy appropriately. Would you agree with that? Or
Yeah, absolutely. You might see things like, I have read, case studies of people who, children who, fatigue is like a big thing. So, and also muscle pain, and endurance. So you might have a child who, there was a case study of this child couldn't walk up the stairs like one leg at a time. They had to take a step, and then that second leg would come and join the first leg, and then take another step. And it was a very slow process. Or children who have trouble getting in and out of the car, or just because of the effort that's required, the muscles just they're not fueled properly. So I believe you would see increased endurance, and that pain would go away. That's definitely a clue. Like if you have a child who complains a lot about muscle pain, even after minimally strenuous task, that's a good sign.
Okay. And what are some medications? Because I also read up on that there are some medications that can impair the production of carnitine.
Yeah, so then this is big for the autistic population as well, because many of them have seizures. So seizure medications, valproate would be one of them, and phenobarbital would be another, that they do inhibit production of endogenous carnitine, so carnitine that we're producing in our own bodies. I wrote other. Let me see if there's any others I wrote down. No, that's all I have here as far as other seizure meds might. But I would definitely, because meds are kind of out of my realm. But so if you had a question about it, I would definitely talk to your physician about if it's affecting.
Because I read how sometimes a doctor may have a child on a anti-seizure medication, but also have them on a carnitine supplementation at the same time. So I guess if you have a child that is low tone and on seizure medication, and they're not taking that supplementation, then it may be something to inquire about the doctor if a carnitine supplementation would be a good idea.
Yeah. And it's also that, ironically enough, a deficiency in carnitine can lead to the medication not working as it should.
Right.
So it's kind of this vicious cycle of you're deficient, and then that deficiency leads to more problems.
Right. Yeah. It's like a catch-22. I was like, what's that?
Yeah,
what's that
pretty
phrase?
much. Yes, I think that's exactly what it is.
So then there is like a supplement, like a pill that you could take it. You don't have to just get it from foods.
Yeah, you can take a supplement. It's a very it's easy to get. You want to make sure, of course, that you're getting from a reliable, trustworthy brand. But it's available over the counter. It's also available as an injection. I believe it's called Carnitor.
Oh,
Is
wow.
the prescription that you can get. And couldn't get any closure on this as far as an answer, but I think if you get it as a prescription, you may be able to get a higher dose.
Okay.
I'm not positive on that, but it isn't available as an injection.
Okay. And so I know I'm assuming that for someone to find out their carnitine levels, is it blood work?
So for finding out your there's like not a good test. You can you can get, let me hold on, I'm just finding my notes here on it. You can get a blood test, but it's not going to tell you, it's not going to tell you function level. It might tell you what's in the blood, but that doesn't mean that that you know what's going on in the cell and how much is in the cell. So you could get a plasma level, but you won't have a function. You won't have a good functional level. So really the best way is just to test with the supplement and see if it helps. I think I wrote down 6 weeks was like the trial. If you try it after 6 weeks, let me see here. That may have been another vitamin or supplement that I was researching. I'm always researching something and they get mixed up in my brain, which is why I write everything down. But it would be it's a safe thing to trial, and for every person the dosage would be different. So if you wanted to try it, I would recommend talking with someone first. Don't just take a random dose, because it'll depend on the weight of the child and the age of the child and that sort of thing.
And I know with physical therapists, we're not allowed, at least in Texas, but I'm in Virginia now, but I think it's the same rules apply probably across the board. We're not allowed to tell parents or patients to take herbal supplements or even over-the-counter supplements. So it would be, you could say something like, oh, when I have a headache, I take ibuprofen, but you'd have to consult with your doctor to see if that's appropriate for you. They could say something like that.
The little disclaimer, you're like, let me scroll my disclaimer on the bottom. Yeah.
Right. But that way, I think it's awesome. So I think on the first interview, you talked about maybe having a subscription for therapists. And now you have built that product about having a subscription and being able to coach someone through or help them with their kids and their nutrition needs. Can you tell us a little bit about that?
Yeah, so this is kind of a new program that I wanted to launch just to make it available for other practitioners like you, PTs, OTs, speech language pathologists. So I was talking about it last time, but basically I'm calling it Dietitian on Call. And basically it's if you have questions, if you get questions from parents and you don't know how to answer them, if you have a inkling that maybe the child that you're working on, that their diet is impacting their function, whether it's through physical therapy or OT, whatever it might be, to give kind of a lifeline to those therapists, because I can't wrap my head around why dietitians kind of haven't wiggled ourselves into the therapy world, because it's so important, like that we're part of the team. Food is huge. And we're finding that more and more, that when there's a dietitian, it's kind of rounding out that team.
Right.
And when you have, you really need that full picture when you have these kids they have a lot going on. So you need to look at it from lots of different angles. So that was kind of the idea behind this product, or program rather, I'll call it. I'm just going to pull up my little
do you have your fees,
here.
like how much you charge?
Yeah, so I'm going to start for the founding members, if you will. I'm going to start it at $30 a month for a 12-month subscription. And you can cancel anytime if you find that it's not helpful for you. I want to work in a way too where if you make a referral and one of your clients works with me, then there's some kind of like kickback incentive for you, because then you may not need to ask me those questions directly. Then I can work with that person and give them customized advice that it's particular to them. So basically what the program would be is, if you get these questions, if you lay awake in the middle of the night and these questions pop into your head about, oh, such and such asked me this, or I wonder how this is affecting this child, you can email me, you can day or night, and I'll get back to you. If I don't know the answer, I will research the answer and find it for you, because like I was saying, I have a speech language pathologist friend, and she was I was asking her, she asked me a question about nutrition, and I was like, do you get a lot of questions like this? And she said, yeah, I do. I was like, well, you don't really text me that much about questions. And she goes, yeah, I feel bad, so most of the time I just look it up myself. And I'm like, that's crazy. You're so busy. Like, you're busy in your field. You shouldn't have to look up the answers to nutrition questions. That's crazy.
Yeah, like I would have known about carnitine and low tone if you hadn't mentioned it in the previous interview, and then it kind of stuck with me. So that's why I was like, hey, we need to talk about this.
Yeah, it's so interesting. It's really fascinating. Actually, because of my research, I'm pregnant right now, and I found out that being pregnant, you have higher carnitine needs.
Oh,
And
wow.
I did not know this. Like, this was, how long have I been studying nutrition? And this was just not something that I knew. So I'm glad that we we
You could
talked
be
about
helping all pregnant women, because I remember just being so tired and fatigued, and
it.
maybe I just needed some carnitine.
Who
That
knows,
I could have been a lifesaver.
Yep, I'm gonna try it out. I actually just ordered myself some.
Well, kind of on the topic still, just today I was telling my mom, like my older son, he used to be very athletic, and then and we've gotten a little bit lazy during the pandemic, but I told my mom, he seems like low tone now. That's why I kind of was asking you, like he doesn't like to drink milk, but he eats really good. He loves vegetables, and you know he eats meat, and he has a good diet, but and I just thought he was having a growth spurt. But when you said always hungry, like he's always hungry. Like we have to stop him from eating because he wants to
Mm-hmm.
eat everything. But he even when he starts to run, like I can just see, like, and the PT in me is like, wait, why, like, what's going on? So now I'm
Mm-hmm.
like, maybe he needs some carnitine. Maybe I should do a 6-week trial. But like I'm not a nutritionist, so I don't know what amount would be appropriate for a child like his size and
Yeah.
weight.
Well,
So I may
you
have
got that
to
question.
I may have to consult with you. You may have to.
Yeah.
The last time after our first interview, someone had commented that they wondered what you would think about Marilax. And since a lot of kids with low tone are constipated, what are your views
Mm,
on using Marilax for constipation?
yeah. Oh. So I will. I'll be honest. I've used Miralax after giving birth. um, it's strong. It works. There is a label, there's a label on the back that says, like, do not use this for more than 14 days. Um, there's a reason for that. It's it's strong, and it's not sustainable. You don't want to be on a medication like that. I don't know if we can call it a medication. I guess I will. Because you're not getting the root cause. So the constipation, yeah, it could be due to low tone. We have our intestinal tract, if things are not working as they should in terms of energy production and the muscle moving as it should, you can get constipation. Um, you may have low tone in your mouth, same as you could have low tone in other muscles of your body. So Miralax, I understand the value of it, but I will say short term, and then you really got to get to the root cause of what's going on. Is it a lack of hydration? Is it a lack of fiber? Is it a carnitine deficiency? Is it what, there's so many things it could be. And it's better to really address it at the root cause. So then you don't have to worry about that, taking that medication for a long period of time, because it's always going to nag you in the back of your head. Like, my kid shouldn't be on this. It says right on the label that it's not good for long-term use.
Right. And when the doctor prescribes it, at least my kid's pediatrician, they're just like, here, take this. You need more? Here. Like, yeah, because on base
Yeah.
they give you like even over the counter stuff. So, and they have the powder one, and I can never find that at the store. But I only give my son
Yeah.
it when he really needs it, like if he hasn't pooped for days.
Yes. Yeah. I would say, because and it can be, oh gosh, there's so much goes. Poop is like my, I swear. Poop is like part of the whole nutrition realm. I'm always talking about poop, so there's no shyness about it. But yeah, there can be if you haven't gone for a few days and there's that kind of like fear of being backed up, that's where
Mhm.
that kind of thing really comes in handy.
Yeah.
It's medications are great when they're used, for those exact situations. Um,
So,
if you have, so because we were talking about seizures and seizure meds, some people, I don't know if you have any clients like this. Some people control their child seizures with a ketogenic diet, so like a high fat, low carb diet, um, and because they're ingesting more fat, you may need more carnitine for something like that
that
because
makes
that
sense.
fat needs to be converted to energy.
That
So
makes
really,
sense.
the whole seizure population, those that are struggling with that, there's a lot to consider with carnitine and that condition.
That's why they need a nutritionist,
Yes,
right?
definitely. If you, yeah, you need a team of nutritionists
Yeah.
probably.
Well, thank you so much for joining me again on the PT Telehealth Coffee Hour. And so now you're pregnant. So what do you drink as your morning drink? Is it coffee still? Or I know you can.
I am drinking. I'll tell you what I'm drinking. I'm drinking an electrolyte drink because my blood pressure goes very low in pregnancy, which is, oh, it's horrible. So I have to drink electrolyte drink first thing in the morning, and I'm still experimenting with my favorite one. I'm trying these powders. I just bought this new powder from Seeking Health. Seeking Health is the brand, and I love this brand. I trust it very much. But I've never tried the supplement of the electrolyte powder, so we will see how it goes.
Well, thank you so much. And I'm glad that we were able to get together again. So
Yeah, this is awesome. Thank you so much.
you're welcome. I'm going to go ahead and hit end. Bye, everybody.
Alrighty. Bye.